Are you telling us that you're giving back the power to the patient?
Well, one of the things that happens as the hypnotherapist, we're only there to guide the process, but really what happens is the individual does the whole change process within themselves with their own internal resources. So we're helping them to contact those internal resources, to clarify for themselves what's their goal, and then make the changes accordingly with the least pain as possible, instead of just struggling or forcing the change process. So in the way, it's really helping the person to be as autonomous as possible, and we're not the ones who are deciding for the other person. We're not the ones controlling the other person. These are misconceptions of what generally people have about hypnosis.
Are there any particular problems that can be better dealt with hypnosis?
Well, as I mentioned, yes, problems going from, well, I deal quite a lot in recent years with people who are in depression, people who have anxiety that they can't control, so diffuse anxiety. I've also I have some specialization in hypnoanesthesia with regard to people who have either acute pain or chronic pain, and which is an approach that can be used in the labor room or at the dentist, or also I'm curious to help people with chronic pain, as to teach them how to use self-hypnosis in order to control their pain. Now, it's not to do away with the pain, because you have to watch out. Pain is a very important information, where the body is saying, well, you need to pay attention here, and you might need some medical services. But once that's done and that's verified, then we can use the tool of hypnosis to help one. Now, I've helped people to prepare for surgery. I have helped people to go on their first plane trip, their first vacation, flying. People also with agoraphobia, people fear of driving. I've had people who couldn't get on the highway, drive on the highway, or even drive their car in any kind of traffic because of fear, and hypnosis has also helped there. I've helped people with stopping to smoke, and people who to reduce their weight. As you can see, I don't intend to use it on myself for that, you know. But again, it depends on what's the goal, and it can be a very important tool.
How does one become a hypnotherapist?
Well, the first course is 145 hours training. In Ontario, what we do is basically for dentists, psychologists, and physicians. Okay, so it's regulated by the government legally to practice hypnosis. In the province of Quebec, now you have more practitioners because we don't have the same legal constraints. So people who are therapists, people who are even in business, people are learning hypnosis in order to help themselves as personal development, to help themselves achieve better results as business people. So again, we can see it in the health context, education. We can see also its use quite more globally than just the medical aspect. So it has benefits, and so the training, which is 145 hours, we at the Institute, Casavant Institute, Institut Casavant Institute, we have the training, the course, which is recognized and accredited by the Quebec Association of Hypnologists. Okay, we use the term hypnologist instead of hypnotherapist because, okay. And we work quite a lot in teaching physicians and dentists as well to how to use this effectively, because there are people who prefer to have that approach than going for the freezing or other aspects. So it's quite interesting to notice how it's getting, again, recognition in society as a normal, natural way to deal with pain and or change.
Now I'm accompanied by Mr. Noël DELCOURT, and he has a few words that he wants to tell you about self-hypnosis before we go to the testimony.
Yes, I want to tell the viewers that these exercises that we do every week need to be done on a regular basis. If not on a weekly, I would suggest on a daily basis for a period maybe of 10-15 minutes at a time. So for people that have sometimes difficulty to let go, I suggest that you would give it a try more often and less longer periods of self-hypnosis, but do it more longer so that your body and your mind adapt to it.
So basically not to get discouraged if you don't find the effects because it's a short period because of the show, but to take more time at home. Great advice. Okay, now let's have a look at this week's testimony.
My name is DEIRDRE, and I had my first contact with a hypnotherapist about 5 years ago. I had heard about him from a friend who had heard something about him on the radio, and I was hoping that I would stop smoking. And I also had a kind of curiosity about it, and I remember joking with a friend that, well, maybe now I'll find the missing link. And I just said it like that. And so I went to the first meeting with the hypnotherapist and found that I felt very at ease with him. And so I went to the first session, and then I started to have a bit of trepidation because although I felt good with the hypnotherapist and the process was very interesting, at the same time I found myself feeling afraid to, let's say, go ahead. I wanted to, but I was now a bit afraid of what I was going to find out. And so it went on, and indeed there were some difficult things to deal with, but at the same time I have to say that the experience of the trance was a very interesting thing for me. It was sort of like inventing a scenario for theater and then finding yourself completely in it. And at the same time, you're sort of watching the whole thing. In fact, I even censured myself a little bit in the sense that I wanted to make sure, I just had that need to feel a little bit in control. It wasn't anything important. And so it went on, and so anyway, it went on for a few months, and then it just seemed that the problems that I had to deal with were pretty much taken care of. And in the meantime, I had noticed a lot of benefits, small things that just added up to quite a big difference. I'd stopped smoking without much difficulty. I really didn't want to anesthetize my feelings anymore. I wanted to live whatever there was to live. I didn't grind my teeth in my sleep anymore. I didn't have terrible menstrual pains anymore. I didn't have nightmares anymore. That was a major change. They were intensified for a while, and then they disappeared for good. And they never came back since. And then I'd have to say, too, that the long-term effects were wonderful, too. I felt more confident. I felt empowered. I felt more present to myself and to the people that I'm around.
Recommendation?
Well, I think that if somebody is thinking of consulting a hypnotherapist, they should make sure that the person has some kind of background in the field and experience, but they should also see how they feel with this particular individual. I couldn't have done it with somebody I didn't feel good with, but so I think that that's a very important criteria too.
Before we bring you the next segment presented by My Health, My Rights, it's important that we mention once again that although this show is about hypnosis, we remind you that hypnotherapy is still an alternative medicine, and there is still ignorance and intolerance by the medical corporation against the natural health practitioners as well as the adult users of these techniques. My Health, My Rights is about consumers wanting the freedom of choice, and once again, let's listen to what they have to say.